Okay, now we're good. Thank you,
Perfect.
Sunita. Over to
Well,
you.
great. Thanks so much, Jay. Welcome, colleagues. It's really lovely to have you with us today for a webinar on GBV risk mitigation and education. I am delighted to be facilitating this webinar on behalf of Irene, um, the Riga for Asia Pacific, who has another commitment, trying to convince our senior leadership on the importance of GBV when we're thinking about El Nino. So delighted to be here on behalf of the working group and our task team on GBV risk mitigation. Next slide, please, Jay. Great. And perhaps just to introduce myself, my name is Sunita. I am with UNICEF based in Bangkok, and work with our GBV and emergencies team supporting country offices in Asia Pacific and more broadly on various issues, including on GBV risk mitigation. So just as an overview for those of you who might be new to joining us for one of these webinars, the Asia Pacific Gender-Based Violence and Emergencies Working Group is an interagency team that's been created to enhance capacity building and technical expertise on GBV and emergencies in the Asia Pacific region. We're incredibly lucky to have two wonderful, dedicated team members, Irene and Jay, who's here with us today. The working group is chaired by UNFPA and the Regional Emergency GBV Advisor, Irene. And membership includes organizations from across the region who are focused on GBV risk mitigation, response, prevention, including preparedness and recovery. There are quarterly meetings, webinars like this, technical support that's available, advocacy briefs on emerging issues. So on climate, recently a really excellent brief was developed on the impact of the crisis in the Middle East on women and girls in our region. So a lot of different opportunities, experience sharing, and so on. If you'd like more information or would like to join the group, there's contact information for Sujata, who is the co-chair with Irene of the working group, and the details there for Irene and Jay as well. And we have a very useful relief web page as well that includes all sorts of resources from across the region and your go-to place if you want to try to get some information that's coming out of this group. So definitely do reach out if you're not a part of our mailing list already. And otherwise, let's kick off this session. Next slide, please, Jay. Perfect. So today's session focuses on risk mitigation. And again, for those of you who might be new, this is our third year of conducting a webinar series on GBV risk mitigation, really trying to share our understanding, to dig into the tools and approaches, and all of these recordings are available. And maybe we can put that link into the chat as well. Thank you, Rowan, for past recordings and so on. So if you've not been a part of our series previously and would like to go back and learn more about what we've covered in the past 2 years, please do so. Today, we will focus on GBV and education. So we'll start with an overview of GBV risk mitigation, then look at what some of the linkages are between GBV and education, just to be on the same page a little bit about how those link. We'll look at it specifically at a tool, a menu of measures on really trying to understand and monitor how we do risk mitigation in education. And then we'll have a colleague, Lorenza from UNICEF, who will speak a little bit more in practice about how this menu of measures has been piloted in Burkina Faso and in Chad, and then we'll open up for some discussion. So with that, I'm going to hand over to my colleague, Rowan, from IPPF, who will take us through this overview of what GBV risk mitigation is. Rowan, over to you. Thanks.
Thank you so much, Sonita. Hi, everyone. I'm Rawan. I'm the Global Senior GBV Advisor working with IPPF, and I'm based in Nairobi. So before we start talking about GBV risk mitigation, we must first align on what GBV actually is. So GBV is an umbrella term for any harmful act that is perpetrated against persons well and is based on socially ascribed gender differences between males and females, and of course, power imbalances. It includes acts of inflict physical, sexual, or mental harm or suffering, and threats of such actions, coercion, and other deprivation of liberty. Of course, GBV exists in every context worldwide and is particularly exacerbated in emergencies. So in emergencies, these dynamics worsen, and we see an uptake in the sexual violence, but also in intimate partner violence as a displacement strains households. We see child marriage also spikes when families lack resources, and we see women denied basic resources. Of course, these are some of the examples of GBV. There are many other examples on the forms of GBV. And just to remember, GBV is a violation of fundamental human rights and is a critical public health crisis. Next slide, please. Thank you. So how is GBV addressed? There is typically three ways or pillars in which GBV is addressed: GBV prevention, GBV response, and GBV risk mitigation. And of course, different types of actors in humanitarian response have different roles and responsibilities for addressing GBV. So it's very common in humanitarian coordination to confuse these three terms, but let's make clear distinction. GBV prevention usually targets the root causes, aiming to stop violence before it starts by transforming unequal power dynamics and harmful gender norms. And because this structural change takes time, it's primarily led by specialized actors. However, non-specialized programs support prevention by integrating actions like promoting the active leadership and participation of women and girls. Now, GBV response is the specialized care that we provide after an accident or incident occurs, such as clinical management of rape, counseling, case management, and legal aid. And of course, this is exclusive responsibility of trained specialists and trained specialists in healthcare, legal aid, psychosocial support, and security. However, every humanitarian actor has an explicit role during a disclosure. We must be equipped with basic psychosocial or psychological first aid and know how to safely refer survivors. This session focuses more on the middle pillar, which is GBV risk mitigation, and is everyone's responsibility. It really fits this call. Everyone in this call have the responsibility or need to know more about GBV risk mitigation. You don't have to be a gender expert. You don't have to be a PhD to do GBV studies or PhD studies to do GBV risk mitigation. You don't have to be a GBV actor or a GBV specialized actor. Risk mitigation is about looking at our programs, our water pumps if we are WASH actors, our classrooms if we are education actors, our food line or food distribution lines if we are FSL actors, and always asking ourselves, does this setup make a woman or a child feel unsafe? And how do we change it to reduce this risk? Next slide, please. Thank you. So it's also critical that we have a clear understanding from the beginning of what we mean by GBV risk, and that we understand that a GBV risk is not the same as a GBV or a form of GBV. So GBV risk is something that contributes to an incident of GBV happening. It can be an environmental, systematic, or operational factor that contributes to an incident of GBV, or making it more likely to occur, while a form of GBV is the type of the GBV that has happened. So for example, sexual harassment is not a risk of GBV. It's a form of GBV. And this risk makes it more likely that sexual harassment will occur, as for example, the fact that girls must pass a police checkpoint in order to access a service delivery point, a school, or a facility. So the examples of GBV forms can include, as mentioned in the definition, can include child marriage, sexual violence, denial of resources, and many more. While the GBV risk can include long distance to service delivery point, for example, or proximity to armed groups, or lack of female frontline workers, or lack of lighting, and many other more risks. Next slide, please. Yeah. So GBV risk mitigation comprises a range of activities and also aims at proactively identifying and reducing these vulnerabilities. It requires us to avoid causing harm through our programs and ensure safe community access, actively improve environmental safety, and know how to safely refer survivors to specialized services. Next slide, please. So, GBV risk mitigation, or what does GBV risk mitigation mean for our work? GBV risk mitigation is not an administrative burden. It is a fundamental requirement for safe, accessible, and high-quality humanitarian programming. When we actively engage women, adolescent girls, and marginalized populations in the design phase, for example, we identify safety barriers early. And this leads to a better designed program in education, for example, when children, especially girls, can access school safely. Enrollment and retention matrix increase. And safe programming directly drives positive sectoral outcomes. Next slide, please. So what does GBV risk mitigation include? In practice, GBV risk mitigation consists of concrete and measurable actions. And this includes conducting regular safety audits and planning, and this can include community mapping and safety planning, safety walks, FGDs, etc., where staff and community members physically map safety concerns. It also includes enforcing meaningful participation of vulnerable groups, women and girls, and other marginalized population in the programming. And this ensures women, for example, hold more leadership seats on decision making. It mandates an active PSA prevention by training staff, displaying code of conduct, and securing feedback channels. Finally, it also involves building capacity among frontline workers to ensure safe, ethical handling of disclosure. Next slide, please. Yeah. So GBV risk mitigation also means proactively identifying and reducing these vulnerabilities. And it also means that GBV risk mitigation means good and safe programming. It requires us to avoid causing harm to our programs, ensure safe community access, and actively improve environmental safety and know how to safely and ethically refer survivors. Next slide, please. So addressing GBV is a collective responsibility, is not one sector's responsibility, it's all of us' responsibility, is not a job for specialists. Safer environment yield better education outcomes and sectoral outcomes, and most risk mitigation actions are simple. Most of them are common sense programming adjustments that doesn't require specialized technical expertise to make these adjustments. That's it from my side. Back to you, Sonita. Thank you.
Thank you so much, Rowan, for taking us through that and giving us such clear and practical information on these basics of GBV risk mitigation. So we're going to dive in now to this focus on education and GBV risk mitigation. We know, and particularly those of you who are working in education and emergencies, that these interventions play a critical role in protecting children and adolescents during crises. However, if not carefully designed and implemented, they can also inadvertently increase the risk of GBV. As Rowan was saying, in emergencies, we often see that there are increases in gender inequalities, weakening protective systems, so an increase in risks that might expose learners, particularly girls and adolescent girls, as well as other marginalized groups. They might be exposed to heightened risks of various forms of GBV in and around education settings. So let's dive in a bit. I will start by saying that we have limited evidence and limited statistics around GBV and education globally and in the Asia Pacific. What we hear and what we see is that there are three consistent issues that really explain this gap. One is around underreporting due to stigma and fear, which is not specific to education, but is something that we see globally. The second is that we don't have and haven't had consistent tools to use really to measure and to document GBV as it relates to education and schools. And lastly, there's a broad definition very often that's been used in the past of violence in schools generally that perhaps wasn't getting into the specifics around GBV. So this is definitely an area for us to continue to invest in and to continue to generate evidence on. But just to say, and I see that this infographic is really small, but it's a really excellent resource from the No Vow data team here in Bangkok that really highlights what we do know around GBV broadly. So according to recent data, 75 million women and girls have experienced childhood sexual abuse. And globally, Southeast Asia has the second highest regional prevalence of IPV, so really high rates of violence. Globally, what we hear and what we see is that 1 in 3 students who are aged 13 to 15 report physical violence or bullying at school, and up to 40% of GBV incidents reported by adolescent girls occur in and around school settings. So we see that there are some statistics that tell us that the rates of violence are very high. And we also know, I think all of us who work on protection and work in education and so on, we also know that we don't need prevalence data to tell us that GBV is happening. So we know that sexual harassment is common and that girls are more likely to face sexual violence, harassment, and social exclusion, whilst boys may be more exposed to physical punishment and bullying. So quite a lot that we see in terms of some of this data, though we know there are the gaps. Next slide, please, Jay. Great. So some of the key drivers of GBV in education are a lot of the same drivers we see in a variety of other forms of GBV that take place in different settings. So the first is around harmful gender norms, where we have social expectations around femininity and masculinity, and the way that normalizes violence and discrimination. That there are power imbalances that exist certainly in society broadly, but also very much so in learning facilities and schools and education, where that power dynamic can lead to harassment or abuse. We also know that there are weak systems and few reporting mechanisms. So there are limited safe reporting channels and weak enforcement. So we see that violence often happens with impunity. And lastly, again, not specifically for education, but really something that we also see is that the way in which structural inequalities affect girls has a real impact. And we'll get into that in the next slide, really looking at trying to understand some of this. But we know that, exactly. So we know that some of these structural inequalities have a very strong impact on education outcomes. So it's not just that we are concerned about the violence itself. We are, of course, and we want to address that. But we also know that if we don't address the GBV risks in an education setting, we're going to have poorer education outcomes. And we see that for a variety of reasons. One, around attendance and dropout. So GBV might lead to fear of attending school, of absenteeism, dropping out, and so on. And that's particularly true with adolescent girls. We see that there are poorer learning outcomes. So violence contributes to being less concentrated, which could have a impact on academic performance, reduced transition. So perhaps they're not going to continue to learn and to progress and so on. So we're really seeing that violence not only has a physical impact, but really then has an impact on the way in which a student might be learning. That their well-being and long-term impacts. Obviously, we know that all sorts of violence have a variety of different kinds of impacts throughout. And then their system level effects. So school violence also affects the overall learning environment. So not just for a girl who's experienced violence, but also for the other students around her. Next slide, please. So what we wanted to really dig into today is a tool that has been developed to help us better understand and better implement and better document how we address GBV risks in education and emergencies. So I'm delighted to be sharing and presenting on behalf of many colleagues who were involved in the development of this tool, which is an education in emergencies menu of measures framework that was developed by UNICEF, Education Cannot Wait, and has been endorsed by INEE to track and mitigate GBV risks in schools. The goal is really to equip educators, excuse me, with practical quantitative and qualitative indicators that can be used to really monitor how we're addressing the risks that might exist. So first, are we understanding what they are? And then how are we addressing those? So how are we mitigating those? It's called a menu of measures because it provides a practical quantitative and qualitative measurement elements that can be integrated into M&E frameworks that exist in education programs. So this is meant to be a piece that contributes to and strengthens the M&E that we have in place for education programming, but brings in this GBV. There is a accompanying guidance note to support users in identifying which parts of this are most relevant, what are the domains, and so on. And we will share the links for that as well as some learning materials in the chat at the end. So as I was saying, this menu of measures is practical guidance that was really developed to support a need that was identified by educators and by people within the education sector to identify, prioritize, and implement context-appropriate actions to reduce GBV across all phases of emergency education programming. It aligns with global commitments, such as the IESE guidelines for integrating GBV in humanitarian action, what we call the GBV guidelines very often, as well as the INEE standards and so on. So this is a tool that can be implemented through our existing programs. It's designed for all education stakeholders, really promoting a do no harm approach. It's emphasizing that GBV risk mitigation is continuous. So it's not a one-off activity, but we're really looking at how do we integrate this throughout our program cycle. So when we're first designing a program, through our implementation, monitoring and evaluation, making adaptations, and then continuing that cycle. It really calls for an inclusive and community-informed approach that's grounded in age, gender, and diversity analysis. So really trying to embrace the need to have a contextualized approach where communities are involved, women and girls are involved, and that it's really trying to understand the diversity of the community we're trying to work with. It highlights the importance of safe referrals, confidentiality, and coordination, and it aims to support inclusive and equitable education strengthening. Next slide, please, Trey. So I'm not going to go through this in a great level of detail, but it is structured around a few different sections. So the first is around these measurement domains, and we'll go into that in a second. What are they? How do they work together? The second section is really about how do we prepare ourselves to be able to integrate this measurement of GBV risk mitigation and those outcomes. What are some of the key considerations? And a decision tree to help users really understand which parts of this are most appropriate based on their context. So do we have GBV services or not? Do we have access in different ways and so on? So it's a decision tree that really tries to help us understand how do we apply this for my specific situation. And then the third section is around those measurement indicators and what are some of the questions you should be asking yourself. So it's really structured to try to guide a user through the process. Next. Perfect. Okay, so let's go through these measurement domains. Jay, do they come up if you... No. Okay. So we have a little bit of an error on our slide. My apologies. That's on me. So the measurement domains that we're going to go through, and we'll go through them in depth. So I'll just read them quickly, and then we'll go exactly to the slide where we are around access to education services and barriers, safety perceptions, coping strategies, coordination, GBV risk mitigation actions, and unintended consequences of programs. So we're looking at a variety of different lenses around our GBV risk mitigation and our education programming. So the first around access, we're really looking at what we call within our GBV space, our AAAQ framework. So availability, accessibility, acceptability, and quality. What are we talking about when we say that? We're looking at first, do education and learning opportunities exist? If so, are they then accessible to everybody? Are there issues potentially with how a girl may go from her home to the school and what happens in between? Is it a safe way to get there? Rowan gave an example of a checkpoint, perhaps as a girl was trying to go to get a service. So some of these kinds of considerations, are we thinking about some of those? Acceptability. So we know in many contexts, girls may not be permitted to be taught by men, or women may not be permitted to be teachers. Or perhaps it's perfectly fine to have classes at any time during the day, but a girl or a boy should not be returning home after dark. So taking into consideration some of these issues around acceptability of the service, or in this case, the education programming that we're implementing, and then quality, also recognizing that. So the AAAQ framework is a real cornerstone in GBV risk mitigation. We do have a webinar that was done 2 years ago, I think, on AAAQ. So definitely have a look at that if you're not familiar with the framework. It's a very easy one to apply and really practical in terms of understanding these issues around access. So that's the first domain. The second is around safety perceptions. So really trying to think about what are the perceptions around safety for women, girls, boys? What kind of impact do those safety perceptions have potentially on a girl accessing education opportunities, going to school? Do those safety perceptions perhaps limit a girl from attending school because they are her parents' perceptions of safety? So they say it's not safe for you to go, and therefore she's not able to attend. So how do we understand and measure those safety perceptions and address them in a way that makes education opportunities more accessible? The third domain is coping strategies. So what are these coping strategies? How are we impacting, how are we thinking about them in terms of program design? Does it have an impact on program implementation and so on? How do we collaborate to minimize the impact of those coping strategies? So really thinking about, boys often might be pulled out of school to work. So we see child labor. What are we thinking about when we think about some of those coping strategies and potentials of violence as it applies to our education programming and our GBV risk mitigation. The fourth domain, perfect, is specifically looking at GBV risk mitigation. So really trying to document as part of our M&E, what are the proactive steps that a program has taken to identify and then mitigate those GBV risks? And is there money that's being allocated to do that proactively? So this is really trying to document our process and the way in which we're trying to be really deliberate in identifying risks and in recognizing that we need to then, in order to address them, in order to mitigate them, that we need to plan ahead and ensure that there's the budget to do so, because it could require hiring more teachers or having different times and so on, building more gender appropriate latrines, etc. The next domain is around coordination. So really looking at how are we coordinating within our education programming with other sectors, particularly around GBV services. How are we equipping education staff, so teachers or counselors, principals, whoever might be those various education staff, how are we equipping them to be able to also handle disclosures of violence and make referrals, not expecting them to become specialized service providers at all, but just that they're able to be those trusted go-to people for a child who might already trust them because they have a good relationship with their teacher, to be able to disclose that violence and have a safe referral. And the last domain is around unintended consequences. So are there indirect effects of the program that could be positive or negative around, excuse me, around GBV, around other issues? So do we see that because school is there are temporary learning services, temporary learning centers, that there are less children who are roaming about during the day, they have something to do, so they're in a safer environment. So perhaps we see that that has a positive effect on violence rates. Whereas if there was no school, perhaps there are more exposures and so on. So really trying to understand what are those indirect effects of the program. Are there consequences on the relationships, and how do these affect program outcomes? So really trying to think critically, not just about what the intention of our program is, but what might happen because of our program, and trying to understand that as we understand the impacts overall. So in practice, what does this mean? I'm just going to give you two examples, in fact. So maybe we can go to the next slide. Perfect. So one around accessibility, or two around accessibility. When we're thinking about these indicators, one could be the number of schools or learning spaces where there's a report that GBV risk mitigation measures have been implemented, and that has led to an increase in retention of girls in school and learning. So we want to look at where have we taken action on addressing a GBV risk and then mitigating it. So doing something, making some adaptation to our program. And based on that, we see that there are more girls staying in school. And so this is number and percentage, obviously, depending on the M&E frameworks we have, we could think about how we want to measure that. And the second one is around really how women and girls are reporting their own feelings around the impact of those mitigation measures. So not just where we have taken them, but also do women and girls report that action, that adaptation has led to a change where they feel more safe going to school, they feel it's more accessible, and so on. So just as an example. The second example that I have is around safety perceptions. So really looking at how do we think that those GBV risk mitigation measures, if they're integrated, do they actually have an impact on feeling safer? Perhaps we've identified there was a risk around not having lighting, and it's dark during the winter time, and so there's safety concerns around outside the school. And so we've decided, perhaps because that's the risk we've identified, that we're just going to put up lights. Perhaps that's not something that makes girl going to school or a boy going to school feel safer. Maybe they feel more exposed. Maybe that's not what they thought was a good idea in order for them to feel safer around that learning space. So really trying to understand, did the action that we're taking have the intended impact in terms of making a space safer? So around that school, around that learning space. And I think another critical piece here is really just recognizing throughout that we really want to center the voices of women, girls, and boys in our M&E processes and frameworks, because it shouldn't be about what I think as a practitioner or as an educator or a GBV specialist, but really understanding from those who are affected, whether those actions, whether those mitigation measures have the real impact. So with that, I am going to hand over to my colleague Lorenza, who's going to take us through a little bit more around how this has been developed, piloted, validated in Chad and Burkina Faso. Lorenza, over to you.
Thank you, Sunita, and thank you for this initiative and for having me today with you. Nice to meet many of you colleagues. I'm based in Amman, so not often we get a chance to interact with colleagues that are based on different parts of the world. So very pleased to engage with you. So just if we can move to the next slide, I will just very shortly take us through how the manual of measure has been implemented and tested. There are 2 points that I think out of the current test piloting in Chad and Burkina we can really highlight. The first one is that, and you'll see on the slide, so there has been a very inclusive and participatory process to develop and context and adapt the manual of measure to the realities of and the programming of those 2 countries. And so speaking to what Sunita was mentioning, I mean, it's a tool that it's grounded on field realities and it's grounded on programs and it's grounded on what it's helpful for practitioners. So as you can see, I mean, there has been, in addition to the key informant reviews, the informant interviews, the desk review, there's also been a validation workshop, a validation that took place through a 4-day workshop in Burkina and in Chad, with experts, not only from the GBV sides, but with education experts, with the M&E colleagues, education cluster colleagues, women-led organization, and importantly also the ministerial counterparts. And this has really brought actors together. And this leads me to the first lessons learned, or the first emerging practice, is that the tool in itself not only offers practical measures, but the tool in itself really fosters country level engagement. So it helps like to start and engage in conversations on strengthening, generally speaking, GBV risk mitigation in education programming, noting that the initial focus is on protracted crises and emergencies, but this is a tool that can be applied across humanitarian development nexus. It can be applied throughout. So this is really something that, in addition to the tool itself, brought value on this strengthened and continued engagement. So after the validation, there has been a phase of field testing, making sure that the tool, so by applying this tool to the GBV risk mitigation intervention that were and integrated into existing response plans. Again, this has helped providing and gathering feedback on the indicators, on the guiding questions. And then the second, and linked to this, there has been another point, very important lesson learned and very important outcome, let me put it this way, a key opportunity, which is the piloting of the toolkit has led to this, has supported or enhanced a comprehensive evidence review. So it has really helped looking at the frameworks and the GBV related frameworks and tools that exist in the education in the education sector to define helping define the scope of the menu of measures, and so it has enabled complementarity rather than duplication. And so after the piloting and the finalization of the tool, there has been an important work on making and sort of progressing towards the institutionalization. And so the tool has been endorsed by the Education in Emergencies. And then, and on this, I mean, I have to say, UNICEF and Education Cannot Wait really supported and played a very important role in institutionalizing this tool. Now, if we move to the following slide, we will be talking about, I will just be speaking very quickly about the opportunities that we see through the implementation and the adoption of the manual of measures. And the first one speaks about institutionalization and the fact that the manual of measure and the utilization of the manual of measures, it gives us a strategic opportunity to collaborate with education actors to look at in-country systems and so how we can influence policies, response plans from the Ministry of Education and ensure systematic that GBV risk mitigation and measurement are systematically embedded into national plans. And so with this, it helps us really grounding the GBV risk mitigation and measurement within the education sectors and clearly fosters accountability. We've had very positive feedback from both the Ministry of Education in Chad and in Burkina on the importance of this tool. The second point, in the words of, and there has been really, and I will move to the fourth point, so the advocacy with donors. In addition, in terms of the institutionalization, in addition of, and speaking about strategic opportunities, one key point that we observed is that the uptake on the side of the education actors and main partners, I mean, Education Cannot Wait supported this, but also we saw, for instance, Safe to Learn, and the director of Safe to Learn, the head of Safe to Learn, really emphasized how the manual of measures, it's not just another guidance document, but it can really make an impact. And so there is a strong commitment and engagement from key education actors and partners to advocate for this. And again, we talk about risk mitigation measures and measurement. And so the momentum is there with main key counterparts, and it really, the use of the manual of measure really helps strengthening engagement with all of those counterparts. The other point that I want to mention, it's about the strategic opportunity around strengthening the alignment and supporting this, as we were saying, non-duplication and complementarity efforts on school-related GBV prevention tools and frameworks. I mean, the strategic opportunities that the manual of measure allows us through this standard and practical guidance for GBV risk mitigation and measurement in emergency context, it allows us to support a standardized but yet adaptable approach to GBV risk mitigation measurement in education in emergencies in particular. And last but not least, there is definitely an important opportunity that this tool gives us in terms of strengthening and supporting joint capacity building, knowledge, and collective learning. I mentioned before one of the key parts and one of the key components related aspects of the piloting was also this generation of evidence review. And so in addition to this, the manual of measure really helps to co-develop and contribute to training materials a development on GBV risk mitigation to co-deliver capacity strengthening modules on GBV risk mitigation and GBV prevention in the education sector. So there is a value in terms of it enables and supports leveraging the comparative advantage of different actors in capacity strengthening and evidence generation. With this, Sunita, back to you with a note of apology because I will have to leave you in 5 minutes for the next meeting. But if there are any specific questions, I'm sure, Sunita, you can take them, and I'm happy also to follow up after as needed. Thank you.
Thanks so much, Lorenza. Super interesting and I think really relevant for all of us to hear a little bit about how the menu of measures has been both developed in such a participatory way, but also the uptake and rollout process with ministries of education. So I think I will hand over to our colleague Winner from IOM, who will be facilitating a discussion and Q&A. So colleagues, do feel free to raise your hand, put into the chat, and as well if you'd like to share any experiences on your own programming and integrating GBV in education programming. But Winner, over to you.
Thank you very much, Sunita. And thanks, everyone. Good morning from Bangkok. So, just to go through quickly and what we've already discussed, I want to believe that if there are any questions surrounding whatever area that has been raised here in the discussions, please feel free to drop it either in the comment section, or you can raise your hand and ask the question. I had seen something about data in the chat earlier on, and I was actually also just about to respond to that. So maybe to kickstart the conversation, let me just state here that the standard best practice when we're discussing GBV, whether for our children in school, like Rawan has mentioned, child sexual exploitation and abuse or commercial sexual exploitation of children. The standard here is not to put forward prevalence data when reporting. Yeah, why there can be a comparative here, maybe, for example, a year-on-year reporting, preferably in percentages among distinct groups of interests. We should all, at every time, refrain from wanting to dish out numbers in that order. So that's it. If there's anyone that has any thing to mention about what has been discussed. Again, we looked at in the beginning, we had highlighted, of course, the differences, because most times we use terms interchangeably. So I love the fact that now I believe we have a clearer understanding of what to address during a prevention programming, or particularly for risk mitigation, and what response also entails. I know these are not new things to us, but along the line, sometimes because of the work that we do, we get carried away, and sometimes we use terms interchangeably. So thank you, Sunita, for highlighting that once again. It has enriched our understanding. And so please, if there are any questions and answers here, anyone with any question can show by indicating a raise of your hand, and then we will be able to provide some feedback on that as well. Thank you. Anyone? Okay, I haven't seen any hand up.
Hi, winner. This is Jay. Thank you for continuing the session, facilitating Q&A. I'm Jay from the Riga team, working in IM capacity. And I have a question actually, deriving from a field perspective about the challenges education specialists really encounter with GBV risk mitigation. For example, when I was in Cox's Bazar, we, of course, as a subsector, had very good collaboration and planning with the education sector on GBV risk mitigation. But always, I think from GBV specialists' point of view, everything is GBV in our eyes, right? We want to mitigate every single risk. But I want to hear maybe if we have education specialists from the sector. From education point of view, is it easy and from education point of view, to integrate GBV into it? Or because I know everybody wants to strengthen their area of work, especially education is a root cause for all success across sectors. I want to hear how much attention or resources do education sector really gets in practice on GBV risk mitigation and challenges. Otherwise, we can talk about GBV risk mitigation as a checklist. Everybody says it's important, but I don't know how well it's being done from education. Thank you so much, winner.
All right, thank you very much, Jay. Um, Interestingly, I might just have a few points to add to that, as I have also worked across in education sector before now, particularly with UNICEF. And so I believe the term Safe School Initiative isn't a new thing to you if you have worked within that sector or had experience with people who have worked there. Among other things, what I know is there is always the provision for risk mitigation, particularly GBV risk mitigation, within the context of the general protection risk mitigation for education sector. And then this also goes in cross-cutting areas such as wash facilities in schools, and also looking at site planning for school siting and location and all of that. But I believe Sunita might also have additional points to add on that, particularly those in education at the moment. Thank you. I don't know if that has addressed any or enriched the conversation. Yes, Sunita, do you have anything to add?
Yeah, I can come in as well, but I'd love to hear also. I saw in the chat there were a few colleagues who introduced themselves as being education focal points for your organization or covering the education and emergencies sector. So also we'd love to hear from you. But yeah, I mean, I agree, Jay. I think if there are no resources being allocated, it's quite difficult. I will say, risk mitigation is one of these parts of our work that actually isn't very costly. If we're doing it from our program design through implementation, we're hopefully identifying those risks as we're first developing a program and doing that program design. So we're trying to understand what are some of those issues as we're implementing. But for example, doing a safety audit is not a costly thing. It's perhaps having to maybe printing out something or having it on your phone or your tablet. So you're able to take notes for yourself, your notebook, and then identifying what are some of those solutions. Perhaps those solutions could have a small cost. Maybe you identify that there need to be new locks on doors, or the distance between latrines and school is far, and so we need to make some structural changes. But very often, a lot of the solutions can be quite I wouldn't say resource free, but I think can be quite light in terms of what that cost is. But it is also something, as you will see in the menu of measures, one of the things we are also trying to do is to encourage that there is funding that's allocated for being able to take those actions. So it's something that we're also trying to advocate for. But Winner, back over to you, as well as to any colleagues from the education sector, in fact, because you have the real world examples.
Thank you very much, Sunita. And I was just going to mention here also that, risk mitigation activities can actually also be embedded in our community engagement efforts, even at the stage of program pre-planning activities. So yes, it is something that can be infused at the very beginning of our program design, and it does not necessarily need to be like a funded standalone effort at that level. But yes, there are certain aspects that might require engaging more robustly, that could require funding. But let us also think outside the box, outside of the traditional gamut of having a budget line for each activity. When it comes to GBV risk mitigation, there are certain things that we can do that do not necessarily require direct funding. Thank you. Yes, colleagues, we're opened much more.
A long comment from Ranju in the chat, Winner. I don't know if you can see the chat.
Yes, I can see that, yeah. Okay, yeah, so Ranju say he'll share 3 points. First, okay, yeah, school curricula should be, sorry, I jumped up. Let me say that again.
Ranju, do you want to come in? You can speak.
But you can speak, yeah, of course. I don't need relate. Okay, so you say first, the school curriculum should be more gender responsive. Textbooks often portray women and girls in household roles.
Sorry, can I?
Are you open now? Yes, please.
Yes,
Go on.
yes.
Thank you.
Yes, yes. Thank you so much for the opportunity. And actually, we are working for gender-based violence in Nepal, Setu Nepal, and at the same time, we are also working for the children in the vulnerable situation. So we are more in touch with the government school in Nepal also. So it is very informative presentation right now you presented. And just I want to add some points that in most of the time in Nepal, the school curriculum, I believe that in the school curriculum, it is more oftenly portrayed women and girls in household role, while women are shown in leadership and professional role, reinforcing it reinforces gender stereotype, gender inequalities, and it is said that the house is the first school of the children, and they learn more from the house and from the parents, what they've seen from the parents, and they learn on that. In the school, it is just for the theoretical part. And the second, parents should be involved in children's education and school monitoring process, since children spend much of their time at home. Because here in the context of Nepal also, most of the children, they send their children into the private school and they think that I'm giving a good education for my children, but they invest their money, but they don't invest their time, the qualitative time. Quantity they give the time, but the quality time, they mostly the parents, it is in lacking. It is very shame to say that, but it is in happening here. Now the third part is, most of the school there is no it is the provision in the government school also, there must be a counselor, so that the children can explore everything. If they are some type of humiliation, some gender-based violence in activities in the school, they can share to the counselor. But the counselor is not, I haven't seen the much effective in the counselor. It should be in the curriculum and it should be in the practical way, not only for the just to say that we have a counselor. So how we can make children to go to counselor, how we can make the environment into the school, so that the children can explore their feelings and their gender-based violence activities, everything else. So I think it is a little bit lacking in the Nepal. I think it is in the most of the Asian country. So I just wanted to add this point. Thank you so much.
Thank you very much, Ranju. Yes, so practically, again, I don't know if we have existing school-based management committees, but these are areas that we can begin to push for changes and all of that. We'll start the engagement perhaps at the school level and then towards management and eventually through the education ministry level. Yes, Magala?
Thank you very much. Good morning, all colleagues. This is Magala from UNHCR Field Office in Herat, Afghanistan. And thanks for providing the very nice and best presentation by all the facilitators. I don't have any question, but I have some points to share here. As you all know about the situation in Afghanistan, that we all are surviving, especially women and girls. Due to the defective authorities here in Afghanistan. You also know that we are also in emergency situation because we receive many returnees from Iran and Pakistan. They have been deported. So, majority of these returnees are girls and children, women and children. So we wish that these type of topics like GBV and also Pei-Chieh, they would be added to the curriculum of the education system here in Afghanistan. But unfortunately, here in Afghanistan, nobody can talk about GBV, especially in front of the de facto authorities. So, but somehow we, UNHCR, we are providing some CFS opportunity for the returnee children in different returnee populated area. Just this was as a point or my view to share in here. Thank you.
Thank you very much, Magala. I definitely understand the context in Afghanistan is tense at the moment. Even as IOM, we also have programs, and the challenges we are facing are similar to all other agencies and NGOs working there as well. But yes, we will continue to look at ways to engage even with the de facto authorities, maybe not directly. Of course, we don't even use terms like GBV when we are talking to them, but we talk about women protection and empowerment in context that way. So thank you very much for sharing the highlights of that. In terms of maybe talking about PSCA and that to in the curriculum, that would take a long while, but in our various spaces of engagement, at least I am aware that there are several women and girls safe spaces that are still operational, even with the presence and the accompaniment of the marams and all of that. But these are spaces that we can continue to highlight some of these points to the participants in this programs. Thank you very much. Yes, if there are any additional questions, please feel free to ask, and we are able to support on that. Any other questions, please?
Winner,
you can put them in the chat. Yes, Jay.
Yes, sorry for interrupting. I just saw there's a raised hand, but the system didn't assign a name. Maybe we can invite the participant. Or if you
Okay.
hear this, the one who raised your hand, feel free to unmute. Thank you.
Hello, this is Habibur Rahman from Bangladesh, UNFPA. I'm working as a technical officer for education and youth. So I just want to share our current program in terms of GBV risk mitigation. That we are now working with the Ministry of Education in Bangladesh, along with other departments of National Textbook and Curriculum Board, and to integrate comprehensive sexuality education in the national curriculum, where GBV risk mitigation will be embedded and integrated throughout the curriculum, where from K to 12 grade, and where it will be incremental and age appropriate from our point of view. Now we are working with to developing a CIS model curriculum, which is based on the ITGSC curriculum developed by UNESCO. And previously in Bangladesh, we don't usually say computer sexuality education. We say health and well-being subject. Under health and well-being subject, we integrated this education. And GBV Risk Mitigation is especially GBV Risk Mitigation related information reference service will be integrated. We are trying to integrate embedded in the national curriculum and textbook. And apart from this, in Bangladesh, we also work with Women Affairs, Department of Women Affairs in their livelihood program, where women, those who receive basically under the social protection service, where women receive vulnerable different kind of supports from government. And in these supports, we also integrated some session while they receive support, and that session, it covers GBV risk mitigation and reference services. And also, we are now trying to work with the Department of Youth because they have a large network for supporting young people and encourage them to become an entrepreneur. So in that technical vocational program, we are now trying to work with them to embed GBV risk mitigation and CSC component in their curriculum, so that all the training schools under the Department of Youth, they cover this GBV risk mitigation and also CSC component all over Bangladesh. So this is our current program is happening in Bangladesh. Thank you.
Thank you very much, Rahman. Yes, that's a good example of efforts that have been made for inclusion of risk mitigation in education. And then it's something that we can all follow through. So yes, the comment here, Rawan mentioned here, it's in the comments, please, we encourage us to reach out to our GBV subclusters at country levels for contextualized guidance and recommendations on GBV risk mitigation. So in each of your country offices or missions, and try to understand the operational context so that we tailor our risk mitigation activities closely to what obtains on the ground. What we share here is best practice and general recommendations. But again, context differs, even though it is still within the same region of operations. But we want to see that in our activities, we are also not doing any harm, and we are not running afoul of maybe local legal provisions, so that we don't run in contrasts with the government's de facto powers within those areas of operation. Thank you. Yes, any other question as we are drawing close to the end of the meeting? If you have any other additional questions, please, or contributions on how best to carry out GBV risk mitigation in our education, let us know. Okay, I see another hand. Is this the same hand or someone else? Oh, okay.
It's a different one. Can you hear me?
Loud and clear.
Okay, thank you so much. I think this has been very informative. And I'm currently in the Pacific, so just also like relating to whatever has been talked about, and most of the things that are really common, like violence in schools. I'm working in the education sector, so just thinking around, I think it's also important to do some awareness creation, especially with the students, the learners, because some of them coming from the communities might not know what really constitutes gender-based violence. They might think it's normal, especially in some communities. So I think it's important to work with maybe government partners, and also with communities and with the learners as well, just to create awareness on what really constitutes gender-based violence. And, you know, we'd be surprised how many cases we'll be having, because from my experience, I think it's they take it like as a norm, like it's normal for them to experience these gender-based violence. So they might not know what it is exactly. So just working with the government partners, development partners, just to ensure that there's a lot of awareness creation within the schools as well as within the communities among the learners. And secondly, also incorporating, I know GBV might not have like a separate budget funding like what was mentioned earlier. So it would be good to maybe also advocate for this to be included. Where I am, it's called like the School Learning Improvement Plan. So this can be incorporated into the school's improvement plan. I don't know what it's called in other contexts, but if GBV can also be part of the school learning improvement plan where schools are able to implement and also just ensure that all these GBV issues are also incorporated and catered for, it would really make schools a safe environment for the learners. So it's really good. And the community engagement that you talked about, I think it's one of the game changers when it comes to GBV. So thank you so much. And yeah, thank you.
Thank you very much. Sorry we didn't get your name.
Maria.
Okay, Maria, with which agency?
I'm with UNICEF in Papua New Guinea.
Oh, okay. Thank you, Maria. That's much appreciated. Yes, and those are areas that we can also think about in our various programming, looking at our community engagement specifically, and then within the school environment. I have heard and also seen in some cases where they have like school clubs that have these discussions from maybe K4 upwards in classes. They begin to talk about aspects of GBV and PSCA and all of that. So just look at what operates within your context and see how best you can incorporate that. And within the allowable time frame of maybe your program design, you can also think outside the box to see how best you can bring in some of these things to improve on GBV risk mitigation measures in your programs. Thank you very much. If there's any additional comments, questions, as we draw down to the end of the webinar. Any further questions or comments? We still have 15 minutes more in the webinar. Okay. In the absence of additional questions, I would return this and ask Senator to conclude.
Great. Thanks so much, Winner. And thank you, colleagues, for your questions, for sharing, and so on. I think there's so much that we can discuss around these issues. And I think something that I was thinking about, Maria, when you were speaking, but also others, was really also around the language that we use with risk mitigation. And that we don't have to use this language saying this is about GBV and so on, depending on your context. If you're in a sensitive place like Afghanistan, or there are different kinds of understandings of what GBV is and what's appropriate and not, we can always go back to the language that Rowan was talking about, which is safe, accessible programming. That's really our goal. We're coming at it with this approach of addressing GBV and mitigating GBV risks, but we really want to see safe, accessible, in this case, education programming. And by addressing those risks, we're going to ensure that there are better learning outcomes and better sectoral education outcomes. So on behalf of Winner, Rowan, Jay, Irene, who's not here, really immense thanks for joining us today. Please, I put into the chat the link for our working group webpage that also includes a link if you'd like to join the mailing list, so you can stay involved and stay aware of future upcoming webinars. We have, as part of our GBV risk mitigation series this year, several upcoming, the next of which will look at GBV risk mitigation and SRHR. Sorry, a little bit of a brain freeze for a second. And then we'll have subsequent sessions on risk mitigation in evacuation centers and potentially some others before the end of the year. So please stay tuned and do join us again. And again, just immense thanks, Rowan Winner, as well, for co-facilitating, and Jay for being with us, even though you're technically on leave. So immense thanks to all, and have a great rest of your day.
Thank you all. Have a great
Thank you,
day.
everyone. Have a good day.
Thank you. Have a good day.